Hi, my name is Mandy and I am with Project Recovery Iowa. And today I have with me Jenny Knoll from Tanager Place, and she's going to be talking to us a little bit about youth mental health first aid. They have an upcoming opportunity for people to get trained in youth mental health first aid. But so first of all, just Project Recovery Iowa, we used to be called COVID Recovery Iowa, and we came about when the pandemic was declared a disaster. And so then the state is able to apply for FEMA funding to provide that additional emotional support that's oftentimes needed in the event of a disaster. So, and then along came a derecho, and we recently had those tornadoes in the Winterset area. So we're here for emotional support for all those folks, and we're happy to get people connected to resources like what Jenny's going to talk to us about today. So take it away, Jenny. Tell us a little bit about Tanager Place and how this is offered through Tanager Place. You were talking about how expansive the services are at Tanager Place, so help us understand that a little bit.
Yeah, absolutely. So Tanager Place is a nonprofit organization in Cedar Rapids, Iowa, is where kind of our home base is. We've been around for 140 years and more. And we really offer a full continuum of care for youth and families. So we offer everything from prevention services, groups and activities for kids to get involved with. We offer Camp Tanager, which has free campership scholarships available every summertime, but we also offer a day camp for students. And we have an LGBTQ youth center, which is kind of a drop-in support type center that provides lots of different curriculum and activities for youth and allies. And then we also offer community-based services, including pediatric integrated health home, intensive case management, and our BHIS community-based skill building services. And then we have outpatient clinical services, including an outpatient clinic that has therapy, medication management, and psychological testing. And then we offer school-based therapy across about 10 districts in our local area. And that kind of equates to a total of about 66 different school buildings. And then we also offer an inpatient program that has two different types of programming available. One is a PMIC program, which is focused more on psychiatric mental illness for youth ages roughly 11 to 18. And then we offer an ICF-ID program, which is really a program for youth who have an intellectual disability of some type. And we offer specialized services based around that care. And then the program that I oversee is actually called the Meraki Institute of Learning, and we focus on education and outreach. So really kind of trying to promote mental health awareness across communities, for families, for professionals that work with youth in whatever kind of capacity. But we also provide a lot of professional development and coaching for professionals that are in the mental health field, that are in the education field. We work with different workplaces to really try to promote mental health within other businesses and organizations, so that ultimately the more people that know and understand mental health, we can have healthier generations. So really kind of believing that no matter how we engage with a youth or an adult, we're really helping youth at the end of the day to have more access to adults who know what to do and how to support them in ways to cultivate that positive mental well-being.
I always kind of thought of Tanager Place as a campus. So I think it's really helpful to hear about all the different ways that you're reaching out into the community and beyond. So impressive. You guys cover a lot of ground. So youth mental health first aid training that you have coming up. You said, I think in an email, that you offer them regularly.
Yeah, we sure do. We've been doing youth mental health first aid trainings now for a little over 5 years probably. And we have 3 trained instructors currently that all are able to provide this. And we are able to provide youth mental health first aid in a variety of different contexts. So it used to be 100% all in person. And then of course, COVID changed everything in the world. And the National Council, who actually is kind of the founder or the writer and creator of the youth mental health first aid curriculum, came out with a virtual option that is actually really a nice format. It's called a blended version. So there's about 2 hours, depending on kind of how how diligent you are about it, of pre-coursework that is really easy and user-friendly that people complete on their own time, just at your own pace before the actual course. And then there's a live instructor-led session, and that session can be either virtually or in person. So what we've actually been finding since COVID, and even since we've been able to do in person again, is that a lot of people have still preferred that virtual option because it allows them to connect from anywhere, and it really just opens up that access. So we've been really excited to offer this course still throughout COVID, especially as we know the needs of youth and in the mental health have increased so significantly over the last couple of years and even continue to do so. So this course is really focused at helping adults better understand the way that mental health presents specifically for youth, for teenagers. You know, in our field, we talk a lot about kids aren't just mini adults, and even teens aren't mini adults. And so when we think about things like depression or anxiety, or even other mental health disorders, those beginning symptoms can look different when they present for an older child or a teenager. And so that's really where youth mental health first aid can be so important, because it helps give adults kind of that new awareness to be able to recognize those signs and symptoms specific for that age group. And then really kind of what can you do after that? How do you approach the conversations? How do you respond if somebody, a teenager that you care about, kind of starts to talk about their struggle with mental health or struggle with mood or anxiety, or even feelings of suicide? So it really kind of provides those tools specifically for adults who come in contact with youth a lot.
We've had, I mentioned this to you, we've had some teens who have participated in a teen psychological first aid training, and which is kind of crisis focused. And some of them are graduating and turning 18, and we're looking for additional opportunities. And you said that this would probably be appropriate for them.
Yeah, absolutely. Anybody ages 18 and up can attend youth mental health first aid. And we're really excited too, because the National Council has recently partnered with Lady Gaga's organization to develop a teen mental health first aid course, which we're in the beginning phases of implementing. And so hopefully within the next year or so, we'll be able to offer that as well. I'm hoping for much sooner, but you never know with timelines. There's so much that we're in control of and so much that we're not. But that one is actually really focused on going into schools and working with groups of teens and helping them to also have those conversations peer to peer. I think in my own clinical experience, even personal experience, I've heard a lot of teens say, you know, my friend mentioned this and I don't know how to respond, but I care a lot about them and I don't want to get them in trouble, but want to be able to help them. And so really kind of being able to give those tools directly to teens is so important. So absolutely, if there's somebody who's 18, I would strongly encourage them to attend this one as well.
And then when we say youth, is there like I'm thinking about maybe not so appropriate for childcare providers. If they're working with kids 5 and under, there might be other opportunities for them.
Yeah, so the youth mental health first aid curriculum is identified to target the signs and symptoms of mental health needs for youth that are ages 12 to 18. So for those that are working with younger ages, it wouldn't necessarily speak to some of those developmental issues that you begin to see, or even you know, like the early signs of ADHD in that age group. But again, if you're working with kids that are that young, likely you're working with or interacting with other teenagers in some capacity, whether they're your own or, you know, I remember working in a daycare facility as a high schooler. So it might even include some of the staff that you have as well. So I really struggle sometimes to find a person that it wouldn't be a good idea to attend a youth mental health first aid or even the adult version. Just because the more information that everyone has, the more open people can be about mental health, and the more willing and available they can be to talk about signs and symptoms that might help lead somebody to care much sooner, which we know from research really leads to better outcomes in the long run. So I think it's a great tool regardless of what your profession is.
And you mentioned too, especially if you're an 18-year-old and you're interested in a career in mental health, it would be great, a great experience for them. You have your upcoming training. Can you give us, how do we register, some detail? We can put links in the comments after, but tell us a little bit about dates and how to register for that.
Yeah, you bet. So our upcoming session of Youth Mental Health First Aid takes place on May 13th. We do ask for everybody to register by April 29th because we like to give that full 2-week time period for people to complete that 2 hours of pre-course learning. But if you don't get a chance to register before the 29th, you can always email me. There's an email line right under where the tickets are at. On our Meraki Institute of Learning website, which is www.merakiinstitute.org. And those links will come out in the post as well. And we have another 3 sessions already scheduled still for this calendar year for Youth Mental Health First Aid. So you can see those additional offerings on the website as well. And if you live in or work in the East Central region, so the 9 counties that are part of that region, then the region actually has a coupon code that you can use to receive free registration for these trainings, because we really want to make them as accessible as possible. And so I'll be sure to add kind of information about that as well in the post. And then we also offer this training for communities, for church groups, for youth groups, for organizations that might want to host it on site, or say like we have a group of 20 adults that are all working in this area and we'd like to host a session of Youth Mental Health First Aid. Just reach out to us and we're happy to coordinate and see if we can provide that for your community, organization, or group. And then also we have some resources that really help with getting the funding for that as well. So we try to make it as accessible as possible and keep it happening.
That's excellent. Free. Did y'all hear that? There's ways to get it free. We have a few people watching live, it looks like, so let us know if you have any questions or comments. I can relay those to Jenny today. What else do we need to know? Just a couple minutes left.
Yeah, so as an organization, Tanager Place always celebrates May as Mental Health Awareness Month. And so with that, we have some other exciting activities going on this month. Our first one is May 6th. We are coming back with our first in-person Resilience and Trauma-Informed Care Symposium. And this year, we're really excited. We have Dr. Tina Payne-Bryson, who is the co-author of The Whole Brain Child and the Yes Brain with Dr. Dan Siegel. And so she's going to be talking a lot about how to really cultivate that yes brain in youth. It is geared kind of for those in education, in childcare, in mental health, any kind of professional working with youth. So if that's something that appeals to people, that's a free event, and the tickets are also available on the Meraki website. And then we'll be adding another virtual lunch and learn that's more specifically focused on parents. We don't have the date on that one yet, but it'll be coming out soon, so watch the website. And then we also are offering a couple other free events throughout the month. One is a lunch and learn focused on mental well-being in the workplace, and then a day of caring for those who are caregivers. So anybody kind of in a caregiving profession, there is a full day workshop. We're partnering with the Restoration Project out of Cedar Rapids to really provide kind of a retreat and day of self-care and recentering and grounding for those who do the hardest work. It's a never-ending battle, and right now we know that there's so much need out there. So it's important to take care of ourselves as we take care of others.
Very good, very good. So when you say lunch and learn, I'm thinking, are those only in person?
Nope, they're actually virtual. So grab your lunch and hang out with us and learn while you're snacking, I suppose. So yeah, we do those virtual again to make sure that as many people can come as possible. But if there's any topics or any pieces that somebody feels passionate about that they want to bring to something local or on site, whether it be at a workplace or at a youth group or some sort of a community organization. We do a lot of kind of on-site presentations and events. So we're always happy to partner and collaborate on how we might be able to support those goals.
Is that still kind of within that region you were talking about?
So we do that actually across the state. So we have had lots of different groups reach out to us and ask for some of that support. We partner with different organizations, everything from, we've had, like I said, church groups, we've had a reading group that's kind of a literary organization. We've done different workplaces, schools, early childhood care centers, all sorts of different organizations that we've partnered with.
Very good. How about I think it was Dr. Siegel you mentioned, is that in person or is that online or?
Yeah, so Dr. Tina Payne Bryson, she's going to be in person, and that is going to be May 6th at Hotel Kirkwood. And it's just in the morning time. So we have kind of an early check-in and then a little bit of coffee and networking, and then her keynote address, I believe, starts at 9 and goes until 12. So it's kind of a nice way to end a week. It's on a Friday at Hotel Kirkwood. But again, it's a free event. We are requiring vaccination for the event, just as one piece, but hopefully next year we'll be back with the full day and lots more excitement then as well.
Sounds excellent. We'll put links to all this information and how to access these trainings in our comment section. And if you have a question for Jenny and didn't get it put in there, I will relay that to her. So thank you for your time, Jenny. Keep doing what you're doing.
Yes, thank you guys all for hosting this and for providing this resource to our state.
Yep. Take care.
Bye.